Sepsis, a critical care challenge. Sepsis, a life-threatening condition, arises from the body's dysregulated response to infection. This dysregulation can rapidly lead to organ dysfunction and, in severe cases, septic shock. Early recognition and intervention are paramount in improving outcomes for patients with sepsis. Delays in diagnosis and treatment significantly increase the risk of mortality. Therefore, healthcare professionals must maintain a high index of suspicion for sepsis, particularly in patients presenting with signs and symptoms of infection. Prompt initiation of appropriate management strategies is crucial to interrupting the devastating cascade of sepsis. The Surviving Sepsis Campaign, SSC, provides evidence-based guidelines for managing sepsis and septic shock. Adherence to these guidelines has been shown to significantly improve patient outcomes. Recognizing the enemy sepsis and septic shock defined. Sepsis is a complex syndrome that arises from a dysregulated host response to infection. This dysregulation leads to life-threatening organ dysfunction. Septic shock represents the most severe form of sepsis. It is characterized by persistent hypotension requiring vasopressors and a serum lactate level greater than 2 millimoles per liter, despite adequate volume resuscitation. Recognizing sepsis early is crucial for initiating timely and appropriate interventions. Healthcare providers must be vigilant in identifying patients with suspected or confirmed infection who exhibit signs of organ dysfunction. These signs can be subtle and may include altered mental status, tachypnea, tachycardia, and hypotension. Early diagnosis and the initiation of appropriate treatment are paramount in improving outcomes for patients with this life-threatening condition. The first hour, the essence of early sepsis management. The first hour of sepsis management is critical. This period, often referred to as the golden hour, can significantly impact patient outcomes. The Surviving Sepsis Campaign, SSC guidelines emphasize the importance of early recognition and intervention in sepsis. One of the key components of early sepsis management is the administration of broad-spectrum antibiotics. Antibiotics should be administered intravenously as soon as possible after recognizing sepsis. Another crucial intervention is fluid resuscitation. Rapid fluid administration, typically with crystalloids, is essential to restore intravascular volume and improve tissue perfusion. Early goal-directed therapy, which involves monitoring and optimizing oxygen delivery to tissues, is also an essential component of early sepsis management. Early recognition and adherence to the SSC guidelines for the first hour of sepsis management are crucial for improving patient outcomes and reducing mortality. Section 4. Beyond the initial hour, advanced sepsis management. While the initial hour of sepsis management is critical, patients often require ongoing support and advanced management strategies. This can include hemodynamic monitoring, vasopressor therapy, and other organ support measures. Hemodynamic monitoring plays a crucial role in guiding fluid management and vasopressor therapy. Invasive monitoring allows for continuous assessment of blood pressure, cardiac output, and other hemodynamic parameters. Vasopressors are medications that constrict blood vessels, increasing blood pressure. They are often necessary in septic shock when fluid resuscitation alone fails to maintain adequate blood pressure. Norepinephrine is the first-line vasopressor recommended by the SSC guidelines. In addition to hemodynamic support, patients with sepsis may require other organ support measures like mechanical ventilation and renal replacement therapy. Advanced sepsis management involves a multidisciplinary approach requiring close collaboration among healthcare professionals. Section 5. Winning the battle. Adhering to guidelines for improved outcomes. Adhering to evidence-based guidelines is paramount in the battle against sepsis. The Surviving Sepsis Campaign guidelines provide a roadmap for healthcare professionals to deliver timely and effective care. Studies have consistently shown that adherence to these guidelines is associated with reduced mortality rates in sepsis patients. The SSC guidelines emphasize early recognition, prompt antibiotic administration, aggressive fluid resuscitation, and source control. Hospitals and healthcare systems play a crucial role in implementing these guidelines through protocols, education, and performance improvement initiatives. Regular audits and feedback mechanisms can help identify areas for improvement and ensure consistent adherence to best practices. Ultimately, winning the battle against sepsis requires a multifaceted approach that encompasses early recognition, timely intervention, adherence to guidelines, and ongoing support for survivors. Section 6. The unending fight, education and awareness as weapons against sepsis. The fight against sepsis is an ongoing battle that demands constant vigilance and unwavering commitment. Education and awareness are our most potent weapons in this fight. Healthcare professionals at all levels must receive ongoing education about sepsis. This includes recognizing the subtle signs and symptoms, understanding the latest diagnostic and treatment guidelines, and appreciating the importance of timely intervention. Hospitals and healthcare institutions should prioritize sepsis education as part of their continuing medical education programs. Simulation training can provide valuable hands-on experience in managing sepsis scenarios. Public awareness is crucial in promoting early recognition and seeking timely medical attention. By raising awareness about this life-threatening condition, we can encourage individuals to seek medical attention promptly when they suspect sepsis.